Your body is screaming at you right now. Most people ignore it. Then one day, they end up in an emergency room wondering why they didn't see it coming. But here's the truth. Your heart sends warning signals months, sometimes years before a major problem hits. The question is, are you listening? I'm going to share something with you today that could literally save your life. These aren't the obvious signs everyone talks about. These are the subtle, sneaky warnings that most doctors don't even mention until it's too late. And by the end of this video, you'll know exactly what to look for. Let me start with the most misunderstood sign. Fatigue. Not the kind where you're tired after a long day. I'm talking about the bone-deep exhaustion that doesn't go away no matter how much you sleep. You wake up tired. You drag through your day. Coffee doesn't help anymore. Here's why this matters. When your heart isn't pumping efficiently, your body doesn't get enough oxygen-rich blood. Your muscles, your brain, your organs, they're all running on empty. This isn't normal tiredness. This is your cardiovascular system struggling to keep up with basic demands. But most people brush this off. They blame stress. They blame age. They blame their busy schedule. Meanwhile, their heart is literally crying out for help. Studies show that unexplained fatigue is one of the earliest warning signs of heart disease, especially in women. Yet it's the most commonly ignored symptom. Now let's talk about something even more subtle. Shortness of breath during normal activities. Notice I said normal activities, not running a marathon. Not climbing Mount Everest. I'm talking about getting winded walking up a single flight of stairs. Feeling breathless after carrying groceries. Needing to catch your breath after a short walk. This is huge. Your heart and lungs work together as a team. When your heart can't pump blood effectively, your lungs have to work overtime to compensate. The result? You feel like you can't catch your breath doing things that used to be easy. Here's what makes this tricky. The decline happens so gradually that you adapt to it. You start avoiding stairs without even realizing it. You park closer to the entrance. You make excuses about why you don't exercise anymore. Your body is adjusting to a failing system, and you're calling it getting older. But wait, there's more. Let me tell you about a warning sign that sounds completely unrelated. Swelling in your feet, ankles, or legs. You might notice your shoes feel tight by the end of the day. Your socks leave deep indentations. Your ankles look puffy. This happens because your heart isn't pumping blood efficiently through your body. Blood pools in your lower extremities. Fluid leaks into surrounding tissues. This is called edema, and it's a classic sign of heart failure that most people attribute to standing too long or eating too much salt. The scary part? By the time you notice significant swelling, your heart has likely been struggling for a while. This isn't something that happens overnight. It's a progressive condition that builds slowly over months or years. Now here's where it gets really interesting. Irregular heartbeat or palpitations. Your heart suddenly feels like it's racing. Or skipping beats. Or fluttering in your chest. Some people describe it as a fish flopping around inside their ribcage. These sensations can be terrifying. But here's what you need to understand. Occasional palpitations can be normal. Stress, caffeine, lack of sleep, they can all cause your heart to skip a beat. The red flag is when these episodes become frequent, last longer than a few seconds, or are accompanied by other symptoms like dizziness or chest discomfort. Atrial fibrillation, one of the most common types of irregular heartbeat, significantly increases your risk of stroke. It's not something to ignore or hope goes away on its own. Your heart's electrical system is malfunctioning, and that requires medical attention. Let's move on to something that surprises most people. Persistent cough or wheezing. You might think this is a respiratory issue. Maybe allergies. Maybe a lingering cold. But sometimes, a chronic cough is actually your heart sending an SOS signal. When your heart can't pump blood effectively, fluid can back up into your lungs. This is called pulmonary congestion. The result? A persistent cough, especially when lying down. Some people cough up pink or blood-tinged mucus. Others experience wheezing similar to asthma. Doctors call this a cardiac cough. It's often worse at night because when you lie flat, gravity can't help drain fluid from your lungs. Many people end up sleeping propped up on multiple pillows without realizing why they need to. Now let me tell you about a symptom that's particularly common in women but often gets dismissed. Unusual fatigue in the jaw, neck, or upper back. Not chest pain. Not the classic heart attack symptoms everyone knows. Just a vague discomfort or heaviness in areas you wouldn't typically associate with your heart. Women are more likely than men to experience these atypical symptoms. They might feel pain between their shoulder blades. Discomfort radiating to their jaw. Unexplained neck pain. And because these don't match the textbook description of heart problems, they get attributed to stress, poor posture, or muscle strain. This is dangerous. Research shows that women are more likely to die from their first heart attack partly because they and their doctors don't recognize the warning signs. The pain doesn't have to be crushing chest pressure. It can be subtle, intermittent, and easy to dismiss. Here's another critical sign that most people overlook. Sudden onset of indigestion, nausea, or stomach discomfort. You might think you ate something that didn't agree with you. You take an antacid and hope it passes. But sometimes, what feels like heartburn is actually your heart in distress. The vagus nerve connects your heart to your digestive system. When your heart is struggling, this nerve can send confusing signals that manifest as stomach problems. Some people experience persistent nausea. Others feel uncomfortably full after eating very little. Some develop what seems like chronic acid reflux that doesn't respond to typical treatments. The key is recognizing patterns. Does this indigestion come on with physical exertion? Does it improve with rest? Is it accompanied by any other symptoms like sweating or shortness of breath? These details matter enormously. Let's talk about excessive sweating, especially cold sweats that happen without physical exertion. Your body breaks out in a clammy sweat while you're just sitting on the couch. You wake up drenched in the middle of the night. This isn't normal perspiration from heat or exercise. When your heart is under stress, your body activates its fight or flight response. One result is sudden, profuse sweating. It's often described as cold and clammy rather than the warm sweat you'd get from working out. This can be a warning sign of an impending heart attack or significant heart disease. People often dismiss this as anxiety or hormonal changes. And yes, those can cause sweating too. But when combined with other symptoms, unexplained sweating deserves immediate medical attention. Your body is literally in panic mode trying to deal with a cardiovascular crisis. Now here's something that might surprise you. Persistent dizziness or lightheadedness. You stand up and the room spins. You feel faint during normal activities. You have moments where you feel like you might pass out. This happens when your heart isn't pumping enough blood to your brain. It could be due to an irregular heartbeat. It could be because your heart muscle is weakened. It could be a valve problem. Whatever the cause, your brain isn't getting the oxygen it needs, and that's serious. Some people experience near syncope, which is almost fainting but not quite losing consciousness. Others have actual syncope episodes where they black out completely. Either way, this is your cardiovascular system failing to maintain adequate blood pressure and circulation. Let me tell you about one more sign that's often missed. Changes in your skin color, particularly a bluish tint to your lips, fingernails, or skin. This is called cyanosis, and it indicates that your blood isn't carrying enough oxygen. When your heart can't pump efficiently, oxygen-poor blood circulates through your body. The result is a subtle blue or grayish discoloration, especially in your extremities. Some people notice their nail beds look darker. Others see a change in their lip color. This is a late-stage sign that shouldn't be ignored. By the time you're seeing color changes, your heart disease has likely progressed significantly. But catching it at this stage is still better than waiting until you have a major cardiac event. So what should you do if you recognize any of these signs? First, don't panic. But also don't ignore them. Schedule an appointment with your doctor as soon as possible. Be specific about your symptoms. Write them down if you need to. Include when they started, how often they occur, and what makes them better or worse. Second, understand that early detection is everything. Heart disease is much easier to manage in its early stages. Lifestyle changes, medication, and monitoring can prevent progression to more serious conditions. But you have to catch it early. Third, know your risk factors. Family history of heart disease. High blood pressure. High cholesterol. Diabetes. Smoking. Obesity. Sedentary lifestyle. The more risk factors you have, the more vigilant you need to be about warning signs. Here's the bottom line. Your body doesn't lie. When something is wrong, it sends signals. The tragedy is that most people ignore these signals until it's too late. They convince themselves it's nothing. They're too busy to see a doctor. They don't want to seem like they're overreacting. But here's what I want you to remember. Heart disease is the leading cause of death worldwide. It kills more people than all cancers combined. And in many cases, the first symptom is sudden death. No warning. No second chance. Just gone. That's why these early warning signs are such a blessing. They're your body giving you a chance. A chance to get checked out. A chance to make changes. A chance to potentially add decades to your life. Don't waste that chance. If you recognize even one of these symptoms, especially if you have risk factors, talk to your doctor. Get your heart checked. It could be nothing. But it could also be the wake-up call that saves your life. Your heart has been beating every second of every day since before you were born. It deserves your attention. It deserves your care. And most importantly, it deserves you to listen when it's trying to tell you something is wrong. Pay attention to these signs. They're not just symptoms. They're blessings in disguise.